Hello there, this is Talking Europe on France 24. I'm Catherine Nicholson. Now, we are now more than a year and a half into the Covid-19 pandemic. And while the EU hit its initial vaccination targets this summer, certain member states are still way off that target. And it is starting to strain health services in some places. In recent days in Bulgaria, for example, the government's been speaking to other EU countries about potentially taking in COVID patients. Elsewhere around the continent, infection rates are rising steadily in some places, rapidly in others. Today, I'm speaking to the European Commissioner for Health, Stella Kyriakides. Thank you very much for being with us.
Thank you. Thank you for the invitation.
Let's start off just with a look at the state of the pandemic currently. As I mentioned, there's a differing rate of COVID infection around the bloc, but overall, there is a steady little rise going on. What do you put this down to?
Well, as you said, we are at the crucial stage of this pandemic with several member states now experiencing a new wave of COVID-19. After almost 2 months of, I would say, stable and decreasing trends, the number of infections have been going up in the last few weeks. And this is particularly noticeable in member states with lower rates of vaccination. And as you said, some are already experiencing hospital capacity saturation levels with increasing loss of life.
And should we be alarmed about this EU average increase in infections?
Well, in a pandemic, and from the beginning of this pandemic, I have said that we always need to be on our guard and always need to be prepared. I have spoken to the ministers of health of the member states who are facing these challenges in order to give them all the support. But there is real EU solidarity in terms of support for medicines and taking in patients. But I think that what we need to really focus on is that we need to keep on vaccinating and protecting the population as quickly as possible.
Indeed, on vaccination, the rates vary quite massively across the EU from state to state. Portugal, almost 90% fully vaccinated, down to just 24% in Bulgaria, 31% in Romania at the time of recording. We've also got several Baltic, Central, Eastern European states with fewer than 60% fully vaccinated. Why are there such big differences?
Well, overall in the EU, we have now vaccinated over 75% of the adult population. And I would say that we need to really focus on this because there are differences not only between member states, but also within member states. We are not where we were a year ago. Today, we have safe and effective vaccines to protect everyone in the EU. There is no one-size-fits-all answer to your question. We need to really look at the different realities on the ground. And this is what I have been intensely doing together with the agencies in order to support the member states who are facing the challenges, because the important message to send is that we need to vaccinate and fully vaccinate as quickly as possible.
Well, indeed, our viewers are probably aware at this point that each member state of the European Union is responsible for its own healthcare, its own health systems. But of course, the European Commission involved. What action can and is the European Commission taking?
Well, we are in constant contact with the member states. ECDC is in constant contact with their agencies. We discuss the different types of challenges that they may be facing and how these can be supported. And also looking at issues to do with communication, because ultimately we need to convince the citizens that they need to be vaccinated, that they need to protect themselves and others. And until we have reached these levels of vaccination in all member states, this pandemic will continue to be a major challenge and, of course, threaten loss of life.
And do you believe that this low rate of vaccination in this quite substantial number of member states could actually prolong the pandemic for all of us?
Well, we're talking about a pandemic, so a low level of vaccination worldwide is going to prolong this pandemic. And what we need to combine is the need to have measures in place while we're also increasing vaccinations. And I think that the important thing here is that with all member states, we're working together in this through through our European strategy for vaccines, we're working together in order to increase these levels of vaccination. But I will say again that there is really no one-size-fits-all answer for all member states in terms of those who are facing these challenges with their lower levels of vaccination rollout.
Now, some member states are offering booster shots to their populations. As of just a couple of days ago, 2 vaccines now authorised by the European Medicines Agency for that in the EU. Now, the European Commission set a target for getting overall vaccination up across the continent by the end of the summer. Does the Commission have a target regarding boosters?
The Commission set a target for 70% for the adult population. We've now reached over 75%. The issue to do with booster doses, as you said, Catherine, the vaccination strategies and programs are member states' competence. Mm-hmm. What we have now is the European Medicines Agency opinion that these booster shots or additional doses are important to protect those who are immunosuppressed and the vulnerable. Some member states have already proceeded with offering these booster shots to the vulnerable, to the immunosuppressed. Mm-hmm. And I think this is a very important part of the vaccination rollout programs. Mm-hmm. But we must take our eyes off the actual numbers and make sure that we increase actual full vaccination of as many citizens as possible. Mm-hmm. So we can't look at only the booster shots, but for myself, it's also very important that we look at the numbers of why we don't have, in some member states, reached 70-75% and support them as much as we can. Mm-hmm.
Now, as you said yourself, the pandemic is by definition a global issue. Recently, a senior member of the World Health Organization, Dr. Bruce Aylward, he talked about, in his mind, richer countries not doing enough to help lower income ones to get their populations vaccinated, standing in front of them in the queue for buying vaccine doses, essentially. And he said that if richer countries don't help, then the pandemic will actually last a year longer than it needs to. What did you make of that statement?
I'm in close contact with WHO from the beginning of the pandemic. And what I would say here, and I have always said this, is that we have never been about Europe first. We're dealing with an unprecedented global health crisis. And as Europe and as the European Union and the member states have been constantly sharing and giving support to third countries, to countries outside the European Union. And we will continue to do so because this is a priority for us.
And just in terms of that issue of standing in the way in terms of buying vaccines, could the European Commission do something there, step out of the queue in some sense?
The European Commission and the European Union is already donating almost half of the number of vaccines that are actually being manufactured in the EU. And there was recently a call in the G20, in the conference of the G20, again calling together with WHO for the need to provide vaccinations worldwide. Mm-hmm. And all this throughout, because we are dealing with a pandemic, and this is, when we say no one is safe until everyone is safe, it mustn't just be a cliche phrase. It is actually what is true in a public health crisis.
And just a final question on this issue. The United States recently made a call to all World Trade Organization members to temporarily lift intellectual property rights on the production of vaccines to allow them to be produced more widely and more cheaply. What is the European Commission's position on that?
Well, we say all options are on the table, but the European Union has never put an export ban on vaccines. And what we encourage is all the partners and all the partners that are producing vaccines to continue as we have from day one, and to share vaccines with the rest of the world, as we are doing as a European Commission and as the member states are doing.
Just looking to the European Union's neighbour, the United Kingdom, former member, of course, it's experiencing an even higher rate of COVID infections than the EU average. It's been higher than 50,000 per day. Should the EU's member states be considering tightening their travel restrictions with the UK to limit the spread of infections?
Our agencies are in close contact with all agencies and, of course, with the UK and others. We have put in place, as the the COVID certificate. It has now been in place since the beginning of July. Over 50 countries are now on board to allow safe travel and movement. We're following the epidemiological situation very closely, but ultimately this needs to be a coordinated action.
Now, just on a non-COVID specific question, the new European Health Authority that was announced recently, called HERA, just to tell our viewers a bit more about what's planned, how it would work. Is this about the European Commission getting more say over health decisions taken in member states?
No, health is a member state's competency, remains as such. But yes, what we are moving towards is through our proposal for a stronger European health union. And HERA is one of the pillars that comprises a strong European health union. In very simple words, it will allow us to be better prepared and be able to respond in a quicker way, I would say, in an emergency situation in case of a public health and a cross-border health crisis. We have put into place many ad hoc solutions over the past 1.5 years to deal with the pandemic. This is about having the structural reforms in place with the member states in order to be able to deal with a public health crisis in a more effective response, with a more effective response.
All right, Stella Kyriakides, thank you very much for being with us on Talking Europe.
Thank you so much for the opportunity, Kath.
Thanks to you as well for watching Talking Europe. We'll see you soon here on France 24.